As men, especially as doctors, sometimes we hyper-focus on our career, neglecting other facets of our lives. But that is about to change. This is Dads Before Doctors. Some physicians claim their family is their top priority, but their lives tell a very different story. We'll help each other become family men who are doctors rather than doctors who have families. If it's health, wealth and legacy, emotional well-being, parenting, professional goals, or marriage, we're talking about it. Thanks for listening, and make sure to subscribe. This is Dads Before Doctors, and this is your host, Adam Broussard, MD.
Welcome back to Dads Before Doctors podcast. Today we're joined by Dr. Jordan Frey. He's a plastic surgeon specializing in breast reconstruction. He also has a blog, The Prudent Plastic Surgeon. Welcome, Jordan.
Hey, thanks for having me, Adam.
Can you tell us a little bit more about yourself?
Yeah, so I am a plastic surgeon in Buffalo, New York. I'm about almost 2 years out of practice. And I have a wife and two little kids, 4 and 2, who are nuts. And aside from, my clinical practice, which I'm full-time and focus on breast reconstruction, but do kind of all aspects of plastics, I started this blog basically because I, at the end of my training, realized I had no financial awareness at all. It's something I'd actively ignored. I also realized I was kind of burned out, and on reflecting, I realized a big part of that was due to my lack of financial education. So I started to try and learn more and more about it. And as I sort of started taking steps to turn around, our family situation along with my wife, realized there was a lot of other physicians going through a similar thing. And so just thought it'd be fun to share my story. And then it kind of took off from there.
Awesome. Well, what was it like growing up in the Frey household? What did you learn about, you mentioned you didn't have a whole lot of financial knowledge coming out of med school or residency. Was it talked about, or how would you kind of describe that?
No, it definitely wasn't. And I think that, was a big part of the unhealthy relationship that I had with money. It was always, growing up when I was younger, my parents were together. My mom didn't work. She stayed at home with me and my 2 siblings. And my dad worked for my mom's father, for my grandfather, who, came here and was an immigrant and started his own company and was very successful. And so he worked there, probably making more than he deserved or would have gotten on the open market, you could say. And, so what I saw was just, that money wasn't really an issue. We grew up middle class kind of lifestyle, and everything was fine until I was, around maybe 12 years old or so. And then my parents split up. And because of that, my dad stopped working for my grandfather. He got a job more sort of within his, what he would typically find, which was a lot less money. My mom was not working. And so all of a sudden, money was a big issue. And so because of that, I kind of always had this thing of money's this bad thing and can always be taken away and it causes problems, etc. And also, when they were making good money, they didn't manage it well. I can remember them having super nice cars. I also had no money saved, for my college education. I ended up paying for it all with loans, and that is what it is. I'm not criticizing them. That's what happens to a lot of people, but that's kind of how I grew up with these unhealthy mindset around money. And by the time I got to where I was in medical school and training, and, I was with my wife, I had a really scared relationship with money where I did kind of actively ignore it, because I was at any point, it's just going to turn on me and it's going to be really bad. And I just, don't want to pay attention to it. I want to pretend it's not a factor, but of course it is. And then things just kind of get worse and worse. And I will say my wife was better. She came from more modest upbringing, but where money was kind of talked about, and she was the one to kind of manage it initially, but we both realized we needed to get a lot smarter and start thinking about what we were doing, especially once we had kids and we're actually starting our careers and started learning about financial freedom and that kind of stuff.
So what actions did you take to start kind of getting rid of that, negative mindset about money? How did you start kind of getting out of that mindset, more abundant mindset?
The biggest thing was we just started learning, because we have this, I always say, and it's really amazing, in medicine, all of us, we get through medical school and training, which is so rigorous and difficult. And we basically get through simply because we tell ourselves we got to do it or we can do it. There's no evidence showing us that we actually can. We just believe in ourselves. But when it comes to finance, at least in my case, and from talking to a lot of people, we just think, oh, it's too complicated. I need to hire someone else, or you need I don't have a business degree, this and that. I can't do it. And so we never even try. But in reality, it's actually so much simpler than everything else we're doing in our daily life. So that was the first thing. We read books like The Millionaire Next Door, which is a really great one. The Boglehead's Guide to Investing, Coffee House Investor, just learning these really simple principles like save money. And, which sounds really silly, but my savings rate was 0 throughout residency, even at times when I could have been saving money, just because, again, growing up, I didn't see people saving. It was just well, I guess that's something for later, or that gets taken care of, or, who knows? So just things like that, investing in index funds, making sure you have the right insurance. I had my wife and 2 kids. I had no term life insurance or anything like that. So that was pretty scary. So just simple things like that. And that's really made all the difference of, just this idea that you pay yourself first. You take out of your paycheck some amount for yourself. I think the rule of thumb thrown around is 20%, and I think that's a good one. But you take that out first, and then you pay for everything else. That's a big one. And the other huge mindset shift was with intentional spending. Just the idea of actually thinking about what you're spending money on, and trying to determine if the joy you're getting from that is equal to the purchase price, which is something, I had never thought about. And I think as consumers in America, we're in general pretty bad at, and research has shown that we're bad at it. And we're really poor at predicting what purchases will make us happy. Usually we just get a quick little dopamine hit and then move on. So, we've done a really good job of that, my wife and I think, especially as we've transitioned to now where, I'm making money as an attending and she's making money as a college professor, which allows us to save a huge portion of our paycheck and, use that towards investments and building our financial foundation. So it's kind of a long-winded answer. No,
I think that intentionality, I think a lot of people, even people that are saving, don't really think about, is this leading me to the life I want? Is this kind of like you mentioned, am I going to buy this thing and not use it again for, ever? And it's just going to end up in the closet and until I have a garage sale and it still has the tags on it, kind of thing.
Exactly.
So I think, building that intentionality and really thinking about where you're going and where you want to be. So as you started, learning more about finances, more about mindset in general, when did you decide to start the blog? What made you decide to put it out there on the internet and be vulnerable?
Yeah, I started, it's funny. My wife and I were just talking about this yesterday. We were joking because it was June of 2020. So it was the end of my fellowship. It was the last month and a half of my fellowship. And my wife and kids had actually already moved from, we were in New York City. They moved to Buffalo, where I am now, because it was during the COVID pandemic and it was really tough with little kids and they couldn't go anywhere. So they moved here and we're with family here. And I ended up leaving our apartment and staying in a small room in her aunt's apartment in Brooklyn. And anyway, that's where I started it. Because again, this was a time that I was reading a lot. I realized all the mistakes I had made. And I was like, you know what? It would be kind of cool to show I've made just about every mistake. I mean, I came out with like over $500,000 of debt. I had credit card debt. I had like totally screwed up and missed out on the public service loan forgiveness because I had forbeared and deferred all my loans through training. I had 0% savings rate. I had no investments. I had no idea how to invest. And I was like, if I can figure a way out of this, which is still to be determined, you know, that'll kind of be a good example and show that like anyone can do it. And I'm hearing so much more of people going through the same thing, which I didn't realize. So I was like, well, let's just throw it out there and see what happens. And it's been a lot of fun because I kind of realized there's a lot of great physician bloggers talking about finance, but a lot of them are already at financial freedom. And it's sort of like if you're going through a race or a journey or something and someone's shouting back instructions from the finish line, that's really helpful. But sometimes if you have someone that's just like right in front of you, that's kind of like, all right, you know, this thing's about to trip you up, look out for that. Or if you see them trip up and you go like, okay, I know I need to avoid that, or, oh, they were able to do this and it worked. So I thought that'd be cool to do.
I was actually listening to a podcast earlier this morning and said you need to surround yourself with someone, you know, a couple steps ahead of you, someone in the same, you know, area as you, and then someone right behind you so that you can help pull them up. Kind of, I've heard other people refer to it as like a barrel of monkeys type thing that you want to be right in that
exactly.
middle. So
exactly.
Now you've gotten, you know, pretty heavily into some real estate too, right?
Yeah, that's become a big part of it.
Okay. So how are you able to balance your full-time plastic surgeon, real estate, 2 young kids? I have a 2 and a 4-year-old too, so I know how demanding that can be, you know, with a wife that's working. How are you able to balance all this with the blog, your podcast? Yeah, it's hard. Like people ask that. I don't have a great explanation other than like when things are important or a priority, you kind of find a way to make it work. And it's not like I still have, you know, free time to do things and budget a lot of time for family. It's like, I tell the story and you can probably relate with your kids. Like before we had our first kid, I can remember my wife and I, you know, sitting there and just being like, how the hell are we going to do this? Like, we're already so busy and now we're going to add a kid to this. Like, what are we doing? How are we going to find the time? How are we going to manage? And then you don't answer that question. You just have the kid and then somehow you figure it out. And then you're like, what was I doing with all my time before? And then the same thing happens with a second kid. So it's kind of like that, you know, this stuff has become important to us. And so we find the time to make it work. And I couldn't do it without her. My wife, Selene, is a huge part of it. But it's like the old adage, you know, you can do anything, you just can't do everything. So you just have to find what the priorities are. And it's important within that. We all know in medicine how a lot of times family can take a back seat. And the same thing can happen with all this other stuff, but you have to keep that at the forefront. And, you know, in the end, that's why we're doing all of this. So maintaining that perspective is important. Not that I always do an amazing job of that, but I try to remind myself. It's always a work in progress, but I think you really hit the nail on the head earlier. You said that you budget the family time. So like just having, I think a lot of people tend to let family be an afterthought. It's like, oh, I've got to see my patients. I got to do this. I got to do that. Like I've got to answer this email. And then whatever's left over is what family time is, rather than being once again intentional about like saying, oh, I'm going to, you know, set aside this time to go have dinner with my family, you know, make sure to be home for dinner for the, like when you can and whatnot like that. So I think that you really hit the nail on the head.
Yeah. That. Yeah. I never even thought of it in these terms until you said it really well and kind of lined it up, but it is almost like that pay yourself first with the money thing. It's like with the family time, you have to plan that stuff out first. And then you look at the rest of the time and say, okay, what are the important things that I need to get done, or the things that are going to move the needle the most, and try to eliminate kind of the wasted times. Not like, and I think when people hear that, they think, oh, well, time resting or, you know, watching TV and zoning out, that's wasted time. But not even like, that's actually kind of sometimes important. You need that time to yourself or to exercise or whatever. So it's not that you're always keeping busy. It's just that you're planning out what's going to be best for you.
Yeah. And I mean, on the contrary, you need that time to ensure that your health and wellness, both mentally and physically, so that you can show up the best for your family, for your patients, that you don't end up getting burnt out, because that's when it happens, is when you're not doing this, your own self-care, and then you're not paying attention to the relationships that are important to you, because ultimately that's what people have regrets about on their deathbed, is the relationships that they let suffer, not that they didn't spend another 5 hours at the hospital one day in 2022.
Right.
So you mentioned your why. What is your why for, personally and for your blog? And
yeah, I mean, she's like, I'm very fortunate, and we are, she's really supportive, and, that goes really both ways. But, we kind of joke too, because when I was making this transition to being an attending, that's when I kind of learned about real estate investing too. And we were like moving and all this crazy stuff was going on. And I was like, all right, listen, Selene, this is what we're going to do. I have this plan. And she was just like, you're insane. And I think a lot of people probably would have just left it at that. You're insane. But she was like, all right, I don't know about that, but let's find a time that's a little less crazy and we'll talk about it. And I'm open to learn about it, and then we'll see. And she did. And then she was into it. And so, that's what we've always kind of given each other is at least we'll listen to each other. And, that communication is really good and really important. And then she's also really good at just like teaching stuff. I mean, that's what she does. She's a college professor that teaches teachers. She's like an education PhD. So that helps with me too, because she's just really good at breaking things down and coming up with plans and long-term vision. And so, she's really, really good at that stuff.
You mentioned that, having your why and, it helps, drive you forward. What is your why for your life and for your blog and whatnot?
Yeah, my why is, it's sort of the all-encompassing one. Is just, we want to achieve financial freedom so that we can work on our own terms, because we want to, not because we have to. We really love what we do. I love what I do, being a full-time surgeon. I don't have any immediate plans or even like mid-range plans of backing off or anything. I really like it, but I just know that I'm happier doing something because I want to, not because I have to. And also that gives me the freedom to, really sculpt that time around family. And as the kids get older, I have 2 boys, so, coaching them in sports and things like that, that I want to have those options, which a lot of times aren't necessarily there if you are not financially free, or at least have a really good grasp on your time. So that's sort of like our big why. And then with the blog, my why is to help all doctors become financially free, because I think we've seen a lot in healthcare that there's a lot of problems, and everyone focuses on the problems. There are a lot of things that work well, and there's amazing doctors out there, but there are a lot of problems, and doctors are experiencing burnout. And, the most doctors, I think, officially now are employed, and a lot of them are employed by administrations or private equity groups that are not healthcare based or don't have experience in that arena. But we are subject to that because we are not financially free. But I think one of the biggest things that can help healthcare improve is if doctors are able to become financially independent and are able to walk away from positions that are not good and create positions that are good, and take more of a say in the kind of broader field of healthcare and at a policy level. So I honestly think that is really important. And there's always that taboo in medicine that money's not important, but I really feel the opposite, mostly because when I ignored money, I was not as good a doctor as I am now that I pay attention to money. Again, not to an excessive level, but to enough that your financial well-being is good and not bad.
Yeah, and I think that's, a really healthy mindset that the money is a tool. It's not the ends, that you're just trying to create some large pot of money somewhere for the future, that it's something that will allow you freedom, allow you time with your family, and allow you to practice on your own terms while, still providing good care.
Exactly.
And I think that's what a lot of people, can miss out on sometimes, that it's just about getting the highest paying job or working, so that they can hit that 25X or whatever, so that they can walk away from medicine and hate their life all the way until that point. So you mentioned that, the part of the blog's purpose is filling that hole for the younger attending, the fellow, the resident, to get financially educated. What are some of the, big points that you would hit to help, things that the younger attendings, early attendings need to know? One, to have a healthier mindset and to get kind of jump started on the right foot, and then to help, if that happens, they could help prevent some of the burnout that, the mid-career and late career physicians are experiencing.
Yeah, I think, like I mentioned, I think obviously step number one is just start learning about this stuff, which can seem really intimidating. What I did was I broke it down. Like, I chose one finance book. Mine was Millionaire Next Door. And I just tried to read 10 pages roughly a day. I would do it like before I was going to bed. And I was still a trainee at this point. So, my schedule was even busier than it is now. But I figured that was an easy way to break it up. And then I chose one finance blog, and I just read one post every day. Now do that in between cases or something like that. And I still do that. And that was kind of a nice way to get little chunks that, by the end of a month, and then the end of 3 months, and the end of a year, it's amazing what you pick up just from learning this little bit. And then another great way was I tried to listen to one podcast a week. And like, this is a great one to listen to. And, I think just doing those little things really add up. In terms of more actionable items, this is why I always get pushback on, but like, create a budget, make a budget. My wife and I still budget. And people think of it as really annoying, but it's not when you break down what it's supposed to do. And essentially what it does is help you identify and gauge your spending. And then once you know it, you can then start to think like, okay, is the stuff I'm spending on, am I doing it intentionally? Is it bringing me joy? And how can I adjust it to create the savings rate that I need? Which again, 20% is your goal. If you're in training, it's going to be really hard to get that 20%. When we started, our goal was 1% savings, and then to increase it by 1% each month. So like by the second month, 2%, 3%. So, it's not like you need to get it all at once, but you want to start building those habits to create the savings rate. And then after that, it's kind of fun because you do get to start investing. And I advocate investing in index funds, passive investing, which has shown, to be in the long term better than active investing 80% of the time. It's also really simple. I just ignore the stock market, except for once a year I rebalance back to, my percentages, which is roughly 80% stocks and 20% bonds. But that's all you need to do to invest is to, decide how much stocks you want, decide how much bonds, invest them in index funds, and then ignore it. Those are kind of like the biggest steps. And you can do that pretty quickly. Within 3 months of starting to learn about this stuff, I was able to budget, create a small savings rate, and start investing. And again, I was a trainee, so I was investing like, our first investment we put in was like $500. So it was like nothing, but it felt good to have that and see that money grow a little bit. And now that I make more money, and because we've developed these habits, and now we're saving 40 to 50% a month, we're seeing huge gains in our, steps to financial freedom. So just, again, building those little habits, all of a sudden they'll have really big results once you start doing them for a while.
Yeah, it's crazy to see that hockey stick after a while, when it just starts, you start earning more than you contributed. What's something that people don't ask you, but you wish they did?
Let's see. That's a good question. I think probably too much. People don't ask me about like all the mistakes, especially now, because they'll be like, "Oh, you know a lot about this stuff. You know what did you do right?" But it's mostly like avoiding things I did wrong, which we've covered a little bit. But even for trainees, things like loans, I deferred my loans all throughout. I wish I would have made small payments to at least minimize how much they built up and at best qualify for public service loan forgiveness. I've made mistakes in real estate investing since I started, which I've written a lot about, and real estate investing has helped us grow our wealth, but we've made a lot of mistakes, including missing important things on inspections and having to, undergo big repairs and choosing bad tenants or inheriting bad tenants and things like that. So I think it's always important to ask what people have done wrong or what they wish they would have done better. Because I think with investing, the goal is to constantly win little by little and avoid losing big. And so it's not so much about big wins, which is what people are always more focused on, but avoiding the big mistakes.
Exactly. And, you learn a lot more from those mistakes than the wins. Because if you win every time, you're not going to learn anything. And I know I've made similar mistakes with, deferring my loans and kind of ignoring them until I got out. And I'm like, shit, like they're a lot higher than they were, before when I graduated med school.
Yeah. What's this interest?
Yeah. So just knowing about having that education to know about, those things so you don't make mistakes. And it's even better to learn from other people's mistakes. So being able to put those out there,
exactly.
Whether podcasts or reading about it in a blog or whatever, like you don't have to make that mistake because you saw someone, one step ahead of you that already did it and can tell you what they learned from it so that, you avoid it. So the more that you that you can, surround yourself with those people that are a step ahead of you, the less likely you're going to make the same mistakes they did. So awesome, Jordan. I really appreciate taking this time. Let everybody know if there's any way they can help you and how they can connect with you.
Awesome. Yeah. Thanks for having me on, Adam. If you want to contact me, please, you can go through my website, which is prudentplasticsurgeon.com, or you can just email me. It's jordan@prudentplasticsurgeon.com. But I love hearing from everyone and talking about this stuff. So definitely feel free to reach out.
Awesome, man. I appreciate taking this time out of your busy clinical schedule today and chatting with us. Have a great day.
Yeah, no problem. Thanks for having me. You too.
You've been listening to the Dads Before Doctors podcast. Family men who are doctors rather than doctors who have families. In an evolving and ever fast-paced world, we cannot lose sight of our real priorities. We hope you enjoyed the show. We know we had fun. Make sure to like, rate, and review. And tell a friend about the show. We hope you've gotten some useful and practical information from the show. And we'll be back soon. But in the meantime, hit the website at dadsbeforedoctors.com. Questions, comments, suggestions? Email adam@dadsbeforedoctors.com. And find us on Facebook and Instagram at Dads Before Doctors. Remember, the host of this show is not your doctor, your coach, or your financial advisor. This show is strictly for entertainment. Till next time, this is Dads Before Doctors, signing off.